everyone, my name is Irasema Gonzalez and today I'm going to present to you and to my audience my persuasive speech, which is called Invasive Procedure, Beauty versus Health. To what extent should invasive procedures, such as invasive, can be justified in human beings? There are three areas of knowledge that are related to this topic. These are natural sciences, human sciences, and ethics. Invasive procedures should involve scientists' methods, and in order for a person to proceed in surgery, it is necessary that the doctor has knowledge in theoretical science. This is applied to this topic due to the investigation of human life and human activities. Also, it is related to the surgeries of any type, and of course this involves science to diagnose any illness. Due to the fact that doctors and surgeons need to have some principles, this includes ethics, because they need to stick to them in order to have success in the surgery. Today I'm here to show you and to my audience that invasive procedure, and in certain way invasive, can be justified in human beings. So now you might ask, what is an invasive procedure? Well, the term invasive procedure refers to a type of procedure that involves invasion into internal body by making a break in the skin or by inserting a tube into an internal organ. This information is retrieved from www.fortishospitals.wordpress.com. I believe so, and I speak with confidence that there are different perspectives according to this topic. Some people might say that invasive procedure is something good if it's related to beauty, to health, and some people might say that it's something bad if it's related to beauty. According to American Society of Plastic Surgeons in 2008, invasive procedures should be justified in human beings to investigate the condition of a certain organ or a certain illness, to confirm or to recover just a suspicion of the disease. This information is from Poke and Periodic Health section in paragraph 3. On the other hand, Scott pointed out that extreme procedures regarding to beauty and health should not be justified in human beings because this may cause some infections, illnesses, addictions, and even death. Today's speech is about if it is reasonable and responsible to take health risks in invasive procedures which involve positive and negative effects in human beings, as I already mentioned previously. One argument will be about someone defending the positive aspects about the surgery will bring, and the other hand will be some negative consequences that invasive procedures may bring. At the same time, I will discuss if the procedure can be justified in human beings or not. One of my claims today is that transplant, minor surgeries, and fractures and facial surgeries can increase your self-esteem. First, I'm going to show you a visual aid about some statistics and procedures made in Brazil. Okay, right now, this is something that is occurring in the previous years. Cosmetic surgical procedures have decreased 20% from 2000 to 2009, and cosmetic minimally invasive procedures have increased at 99%. So that is a really big impact in Brazil. Also, Brazil is considered one of the countries around the world with most demand in cosmetic and invasive procedures. This information, I got it from reflectionsinbeauty.com. Back on February, another example is that Terry Dard in 2002 needed to have an invasive surgery because he had a skin cancer and some facial blemishes, and he was under this invasive procedure, and actually it turned out to be a success because it helped him with the cancer, and I think it says here that it turned out to be amazing because the cancer was out of his body. And this involves ethics because the doctor needed to stick to the principles in order to do a good job with him, and also he could go on with his life, and the doctor's knowledge in natural science made a difference because the results were favorable. The doctor's moral ethics were really significant, as I already said, because he kept his principles and his procedure was done with righteousness. This information is retrieved from MD Anderson Cancer Center in 2002. Another example with invasive procedure that is something favorable is when you have a fracture or lesions. This is an example here of Kelly Jarvis in 2011. She's a 19-year-old teenager that was playing soccer, and she suffered from a injury in her ankle, and she went to doctor and she was under an invasive procedure, and again it also helped all the damaged parts that she had and restored them again to a physical original appearance. This involves emotion because Kelly created a higher self-esteem in herself and also a very physical appearance. And now I'm going to present my counterclaims of this speech. Whereas the points that I established previously, there are also some negative connotations that are included in this topic. Some people might say that surgeries can be something negative because it can cause illnesses, deaths, infections, addictions, economic issues, and some religions do not accept this. Furthermore, again, in relation to Brazil, this is another top 5 cosmetic procedures done. The first one is breast augmentation. The second is nose reshaping. The third one is eyelid surgery. Fourth is liposuction, and fifth is tummy tuck. We are seeing here that the number one that increased 84% is the tummy tuck, and the second one most popular is the breast augmentation. Okay. Another example about this is some actress that is called Janice Dickinson. She became addicted to plastic surgery. Imagine that, all the money she wasted. On June 6, 2006, Janice Dickinson admitted that she was really addicted to that, and she has been in rehab due to this addiction, and her first surgery was done at 17 years old. This information is from Ford Hospital blog in 2011. Besides addiction to cosmetic surgery, she also thought of suiciding herself. For this reason, some people say that having surgeries may cause, in sake of vanity, may cause something negative in themselves because it can become addicted and also can even bring to death. Two ways of knowing that are related to this topic are emotion and language. Emotion is connected to this topic because by having an invasive surgery to change a physical appearance, that can create a high self-esteem, and language is involved because in order to have a good decision to go go under an invasive procedure, you need to talk to somebody, you need to hear a doctor, you need to hear interviews, and you also need to be really good in like all the topic in order to do it. Conclusion: based on the knowledge issue and the real situations, extreme measures such as invasive procedures should be justified in human beings due to the fact that it can help to investigate conditions of a certain organ or a certain illness. However, sometimes people are not conformed with their body and they can become addicted to surgery such as Janice Dickinson. For this reason, medicine is working toward less and less invasive procedures in relation to vanity. Thank you very much, and I hope you have enjoyed this presentation. Thank you.